Hello, I'm Dr. Kavya, Associate Dentist, CareNClinic, Clinic, Hampi, Nagar, Vijayanagar, second stage. Patients come to us asking, Doctor, why do I need root canal treatment? You can just extract the tooth. See, root canal treatment is the procedure which is done to save the tooth from going in for extraction. If the tooth is savable, it should always be saved, is our motto. So whenever the decay reaches the initial 1 or 2 layers of the tooth, it can be saved with filling. If at all the decay progresses towards the pulp or the soft tissue of the tooth, which involves the nerves, blood vessels, then the tooth has to be root canal treated. So what does it mean by root canal treatment? It means that all the infected vital tissue will be removed from the tooth, but the tooth is still functional. The tooth still performs the function like your any other normal tooth. But when the tooth is extracted, you lose the tooth completely. And extraction doesn't mean that it is the end of the treatment. Patients ask us, why so much difference in price for root canal treatment and extraction? Of course, it's very difficult to save the tooth, cleaning all the infection from the tooth, making it still functional, capping the tooth. All these is a time-consuming procedure. It requires skill, and extraction too requires skill, but then you lose the tooth, right? So it is always preferable to save the tooth, and because of the extensive technique involved, extensive procedure, the cost depends on it. And so patients think that once the extraction is done, that would be the end of their treatment, where it is not so, because we have to always restore the balance. If we do not restore the balance, what happens? When there is extraction space, there is an opposing tooth to the extracted tooth, isn't it? So that tooth would supra-erupt, right? And the adjacent tooth will move into the space that is newly obtained now because of the tooth that has been extracted. So what happens if these other teeth move? When the other teeth move, there is extra space that is created between adjacent teeth, and there is food impaction, which eventually leads to decay, and multiple teeth might get decayed because of one tooth being extracted and the balance not being restored. So having said that, it is very important to restore the balance once the tooth is extracted. And if you look at the cost factor, replacing tooth also has to be considered, isn't it? When we extract the tooth, how the tooth is going to be replaced. So even that has to be considered. So patients usually think that root canal is less expensive treatment. Root canal is a more expensive treatment than extraction. So let me go in for root canal, but it is not so, isn't it? Okay, so thank you.